Can COPD patients retrain their respiratory muscles? Imagine being able to breathe easier and move more comfortably every day. That's what retraining your breathing muscles can help you achieve. If you have chronic obstructive pulmonary disease or COPD, you might wonder if your breathing muscles can get stronger. The good news is yes, they can. Respiratory muscles, like the diaphragm and the muscles between your ribs, are responsible for breathing. Even with COPD, these muscles can be trained to work better. This training is called respiratory muscle training, and it involves exercises that challenge these muscles in a controlled way. Think of it like lifting weights for your muscles, but for your breathing. There are different methods used in respiratory muscle training. One common way is resistive breathing exercises. These exercises make you breathe against a small resistance, which helps strengthen your inspiratory muscles, the muscles used when you breathe in. Another method is pressure threshold loading, where you breathe through a device that provides a set amount of resistance. There's also normic-apneic hyperpnea, which involves breathing at a steady, controlled rate and volume without changing carbon dioxide levels in your blood. Most programs recommend doing these exercises for about 30 minutes a day, 3 to 5 days a week. This is usually done over 6 weeks. The exercises are tailored to your current strength, often set at more than 30% of your maximum inspiratory pressure. This is a measurement of how much force your inspiratory muscles can generate. The goal is to gradually increase strength and endurance without overexerting yourself. One specific type of respiratory muscle training is inspiratory muscle training. It focuses only on the muscles used to breathe in. Studies show that this can improve your inspiratory muscle strength, reduce the feeling of breathlessness, and increase your ability to exercise. It helps your lungs work more efficiently and makes everyday activities easier. Some research suggests that inspiratory muscle training might be more effective than training the muscles used to breathe out, but both can be helpful. You don't have to go to a clinic for this training. Many COPD patients do respiratory muscle training at home using portable devices. These devices are easy to use and cost around $50 to $100. Regular use can lead to improvements in how well your diaphragm moves and how much force your breathing muscles can generate. This often translates into better exercise tolerance and less fatigue during daily tasks. Adding respiratory muscle training into pulmonary rehabilitation programs can really boost your overall health. It helps combat muscle weakness caused by COPD, which happens because of lung hyperinflation and increased work of breathing. Strengthening these muscles means less shortness of breath, more independence, and a better quality of life. So, to answer the question directly, yes, COPD patients can retrain their respiratory muscles. With the right exercises and consistent effort, you can improve your breathing, reduce discomfort, and enjoy more active days. It's a practical, effective part of managing COPD that can make a real difference in how you feel.